Hi there, I'm Brittany. I'm going to be your nurse today. Can you tell me your name and birthday?
Yes, Jared Street, December 14th, 1986.
Okay. Are you allergic to any medications or foods?
Allergic to C-chlor and cashews.
Okay. If it's all right with you, I would like to do a neurological exam, test your cranial nerves and some strength and stuff like that, and then do your musculoskeletal. All right, so let's get started. First things first, we are going to check out your hands. I'm just going to look at them, make sure there's no deformities, make sure there's no swelling anywhere. While I'm at it, I'm just going to work my way up this arm, and then we'll come back and do some stuff with each joint. Do you have any issues today that I need to be aware of? Any tenderness, any pain anywhere?
Mm-mm.
Have you noticed any swelling of your joints? Have you noticed anything that felt kind of hot to touch?
Mm-mm.
Okay. I'm going to work my way down. Feel both the lateral and the medial, the condyle. Your wrist feels okay. Alright, so first things first, let's start with your upper extremities. We are going to do some range of motion, some strength stuff. We'll get started with your hands. So take your left hand, other left, there you go. We're going to do your fingers. We are going to do flexion, so just bend your knuckles down. And extension, bring your knuckles up. There you go. Bring them back, palm down. We are going to do abduction away from midline, so spread them out. And bring them back together as adduction, or back towards the midline. Next, we're going to do your wrist. So we are going to do wrist. I want to do flexion and extension. Back, palm down, away from midline, turn it out. And adduction back towards midline. Perfect. And then with your arm, we are going to, if you'll kind of keep that, if you'll bend your shoulder back down, perfect. We're going to do supination and pronation. Perfect. Now let's see this hand. So hand out for me. Fingers down, that is flexion. Fingers up, we are going to do extension, back towards palm down. We are going to do abduction with a B, away from the body, and adduction back towards the body. Now we're going to do your wrist. We are going to do flexion and extension, back down, abduction, adduction, perfect. And then back like this, supination, pronation. Perfect. Now let's check out this elbow joint. And both what we are looking for is to make sure this side matches this side and vice versa. So take this elbow. We are going to do flexion and extension. Okay. Now let's do this elbow, flexion and extension. Okay. Before we move to your shoulders and do a few more tests, we are going to do some carpal tunnel tests. So what I need you to do is take your hands. We're going to do the top side. Push them together and try to push your wrists together. This test typically goes for 30 seconds. And then you would take them apart for me. Do you have any numbness or tingling anywhere in your fingers or palms? Perfect. Another test that we could do, that one was Phelan's test. This one, I need you to kind of relax your hand for me. Perfect. And I'm just going to tap right here. Any issues?
No.
And this one is Tennell's test. Still no issues?
No.
Perfect. All right, let's move on to your shoulders. So first things first, we are going to do flexion and extension. You would actually kind of bring it out back behind you. Okay. With this arm, we are also going to do abduction away from the body, and then adduction, bring it across your body. There you go. And to check some more, movement on your shoulder and kind of check, make sure your rotator cuff works like it's supposed to. Take this hand and scratch the base of your neck. Good. And then take it back out and go up underneath and try to touch your other scapula. Perfect. Okay, so let's work on this left shoulder. We are going to do flexion and then extension. Okay, bring it back and go abduction away from the body for me, and then adduction back across your body. All right. Touch the base of your neck for me. Arm on up. Any issues with that?
No.
Okay, and now bring it back underneath and touch your right shoulder. There you go. Perfect. Let's test some strength on your arms. We are going to do a hand grip. It's very simple. So take this hand, grab my hand, squeeze it nice and tight. So that first initial grip is pretty good. I am going to push towards you. Don't let me. Okay, now same thing. I'm going to try to pull you away. Don't let me do that. Okay. switch sides really quick. Same thing with this hand. Your grip is good initially. I'm going to push towards you. Don't let me. And then I'm going to try to pull you away. Good. All right. So now let's check your neck range of motion. So what I want you to do is called flexion for your neck. Touch your chin to your chest. And now extend and tilt your chin all the way up. Good. Bring it back down straight. Cervical rotation is where you turn from side to side. So look over your right shoulder. And now look over your left. Perfect. Back towards the middle. Touch your right ear to your right shoulder. Good. And left ear to the left shoulder. Good. Okay, so now we are going to get up and check your spine. So if you'll stand up for me, kind of turn this way. Now we're going to check. First, I'm just kind of looking, making sure that you don't have any abnormal curvature of the spine. And it doesn't seem like you do. You're not having any spinal complaints today, so that's good also. But I'm just going to walk my fingers down your spine. We're going to start with C7. That one is the most prominent one, and I'm just walking down. And what I want to feel is a vertebra and then a little bit of a space. We don't want them to be right on top of each other. Making sure that they don't feel abnormal, and they don't. So next we are going to do some spinal range of motion. What I'm going to get you to do is I'm going to get you to bend over and touch your toes. Let's check out your hips while you're at it. They both feel normal. There's no bulging, anything like that, and they're even. Same for your shoulder blades. Those are even also. So stand up for me, and then flex. I want you to kind of arch your back and bring your shoulders back just a little bit. Perfect. And that one is actually extension. The bending over is flexion. Next, if you will turn back and face me. There you go. Nope, just like that. We are going to do some rotation. So can you turn one way? Perfect. And then go back across to the other. Okay. Now we're going to lean towards your right. Lean towards your left. Good. Perfect. So now we're also going to check out your hip and your knee kind of while we're standing up. We are going to do extension on your leg just because it's easier to stand up and do this. So what you're going to do is you are going to balance on your left foot and bring that right leg back. Okay. And also we're going to do abduction or away from the body. So kick that right leg out to the side. Any issue with your hip?
Mm-hmm.
Okay. Left leg, same thing, back or extended. Extension, perfect. And abduction away from the body, so out towards the side. All right. Go ahead and sit down on the couch for me, or actually lay down. All right, so some more tests for your hip. This one would be considered flexion. So just bring this leg and straighten it up for me. Good. Any pain?
No.
Okay, relax. Bring this leg up for me. Try to keep that knee locked. Straight down. Any issues there?
No.
Okay. And then we're going to do adduction or adding to the body back towards midline. So cross this leg over. Any issues? Okay. Same thing with this leg. Cross it over for me. Good. All right. And so now we're going to check out your knee. If you will just kind of raise it slightly off the couch. And we are going to do flexion. So raise this leg up. And then I want you to bend that knee and bring it back towards you. Curl it up for me. And then straighten your leg out. Okay, same thing with that right leg. Bend it back. Perfect. And also, while I've got you laying down, we're going to do some tests to check for some meningeal irritation. They are called the Kernig and Brudzinski's test. For the Kernig test, I will passively bring your leg up, and you let me know if it hurts.
Nope.
Okay. So if you were to say that you had pain, what I would do is flex to 90 degrees at your knee, and if that pain went away, that's a positive Kernig sign. We would then ask you to raise your head, and if that pain came back, that's a positive Brudzinski's. So again, I will bring up this leg myself, passive range of motion. Any pain?
Nope.
On a positive Kernig sign, he would say yes, and I would flex it to 90 degrees at the knee. He would then say that the pain went away, and I would ask him to raise his head. And if the pain came back, then that is a positive Kernig because it went away when I flexed his knee, and it came back when he raised his head, and that would be positive Brudzinski's. At this point, I'm also going to check his knees. We are going to do the ballottement test and check for fluid or effusion. So I'm just going to milk the fluid down, and then I'm going to rapidly press on his knees and see if there's any sort of ticking, popping, anything like that. And that's the ballottement test. There was no ticking, no popping, no weird feelings when I was pressing, so that's good. Next, we are going to check for a meniscus injury. And so what I'm going to do is we are going to bring this leg up, and I am going to press on the medial aspect of his knee, and then I'm also going to pull his heel towards that side, and we are just going to slowly straighten that out. Any pain?
Mm-hmm.
Okay, and so now I'll switch and press. We're going to bring it up, and I'm going to press right here on the lateral aspect and pull his foot out just a little bit and slowly straighten that out. Still no pain?
No pain.
Okay, same with this leg. Bring it up. No issues?
Mm-mm.
And let's swap and do this side one more time. Okay, good deal. If you don't mind swinging and sitting up on the edge of the couch for me. We are now going to check range of motion on our ankles and our feet. I'm going to get you to kind of raise this leg up off the couch just so your foot will be in the air. And I want you to flex your ankle and bring your toes up towards the sky. Bring your ankle all the way up, perfect. And then extend it and push it down. Okay. Now bring your foot even and just do that with your toes. Toes up for me and back down. Okay. Same thing with this one. Ankle up and then back down, and then just your toes up and back down. We could also get you to just kind of do a big circle with your ankle, and that would get your range of motion with all of those. So next we are going to check your gait. We're also going to do a test. It's called the Romberg's test. So if you don't mind, I'll get you to stand up for me, and we'll start with the Romberg test. What that is you are going to stand with your hands out like this, palms up or supinated. Just stand there for a couple seconds. Now I want you to close your eyes for me. And you should not sway, you should not move, lose balance, anything like that. All right, relax. If you don't mind, I'm going to get you to back up towards that chair and watch you walk. I need you just to walk across in front of me, and I'm going to check your gait. Go back. And it's also very important to watch them walk from either the back or the front, because sometimes as they walk by you, you'll get limps that you may not have seen. Go ahead and have a seat for me right here. So now we are going to check some reflexes and also do cranial nerve stuff. And while we're at it, and he's got his legs kind of suspended, I'm going to check some strength in his legs. I need you to raise up against my hands. I'm going to put some resistance. Good. And now try to put that leg down. Okay. Same thing with this one. Press up. Okay. And try to put that leg down. Good. So your strength in your legs is good. We also watched you walk and stand up, and that was fun too. We are going to start with your deep tendon reflexes. We are going to start with your ankle and work our way up. We'll do 4. They're graded on a scale of 0 to 4. 2 is kind of what we're looking for normal. Okay? So we're going to just ever so slightly raise that foot. And that reflex is perfect. Same thing with this. That one's good as well. And we're not just absolutely hammering on the back of your ankle. It's more just a gentle wrist flick. Hitting that patella tendon. Perfect. That one is good. Both sets of reflexes were 2+. So now we're going to check your bicep reflex. And I'm going to place my thumb right over that bicep tendon. And I will feel movement as well as see it. So relax for me. You can see that bicep muscle contracting. And then also the same thing back here on his tricep, just ever so slightly. Perfect. Let's do this side. Okay. Tricep reflex. Perfect. All right. Next, we get to see how his sensations are. I'm going to touch him with a Q-tip. One end is very dull, typical Q-tip end, and the other one is sharp. You tell me which one is, if I'm touching you with sharp or dull, okay?
Okay.
Try not to look. I just want you to look straight ahead.
Soft. Soft. Hard. Sharp.
Oops.
Sharp. Soft. Sharp. Soft. Soft.
Perfect. All right. I believe that kind of wraps it up for the musculoskeletal part. Now let's do your cranial nerves, and we should be all set, okay? So typically we start, there's 12 nerves. Typically the olfactory or the sense of smell is not normally tested unless you're having an issue, and you said you're not, so we are going to skip that one. Optic is the second one, and that one was tested when we did your eyes, ears, nose, throat, so we're going to skip that one as well. Next, we are going to check 3, 4, and 6 all get kind of tested together. So we are going to do some following of the pin light with just your eyes. Try not to move your head, okay? Good deal. I want you to look right at my nose. Tell me when you see my hand move.
Right. Left. Left.
Okay, perfect. Next, we are going to do your trigeminal nerve, which is nerve number 5. That is kind of your jaw. So we are going to check that out, and I just need you to clench down on that jaw. Good, and move your jaw side to side for me. Okay, perfect. Next, we are going to do your facial cranial nerve, and that all that entails is kind of the nerves that innervate your face. So I need you to smile, frown. Can you puff out your cheeks? Perfect. And so that wraps it up for nerve number 7. Nerve number 8 is your ability to hear. So obviously you're answering my commands, so you can hear okay. But if there is a question, what you can do is cover one side and say a very common 2-syllable word, okay?
Baseball. Apple.
Perfect. So your hearing is good as well. Next, we are going to do nerve number 9, and that's your glossopharyngeal. So what I need you to do is swallow for me. Perfect. We are also going to do your vagus nerve at the same time. This is just a light to see kind of in your mouth. So I need you to open up nice and wide. Say ah. Your soft palate works good. It's moving just like we want. Swallow for me one more time. Okay, perfect. Also, nerve number, your vagus nerve was nerve number 10. So now we're on nerve number 11, and that is your spinal accessory muscles. And so I need you to shrug for me. Perfect. Do it one more time, nice and slow. Slow that down. There you go. Okay. And then last but not least, your hypoglossal muscle, your hypoglossal cranial nerve is nerve number 12. That is your tongue. So stick your tongue out. Try to touch your chin with it. Can you wiggle it side to side? Good deal. And then I want you to stick your tongue out and try to touch the tip of your nose. Perfect. All right. So that concludes the the neurological and musculoskeletal exam. Thank you.